वालेकुम
अस्सलाम
अस्सलाम।
वालेकुम, क्या हाल है आपके?
अल्लाह का शुक्र, आप बताओ।
अल्हम्दुलिल्लाह, बड़ी गजब उठा रही है माशाल्लाह। अच्छी लग रही है माशाल्लाह। चलो, अब मुझे नहीं आता ये सारे कंट्रोल्स को करना, बिकॉज़ आई हैव नेवर होस्टेड बिफोर ऑन फेसबुक ऑन जूम, सो मुझे थोड़ा सा समझाना होगा if we get a question or anything कि मैं कैसे करूँ, या is it just standard I go into chat and have a look, बस इस तरह होता है?
हाँ, बस आपने जो आपके क्वेश्चंस हैं आप करें जैसे भी, कोई इश्यू नहीं है।
या मैं कोशिश
हम
या मैं
सब
कोशिश करती हूँ कि कोई खुद ही पूछे, it might be better. Okay, तो हकीम साहब आ गए?
हाँ जी, हकीम साहब भी आ गए हैं।
Alaikum.
वालेकुम
वालेकुम
सलाम।
सलाम जी, how are
Oh,
you? That's a nice setting, mashallah.
it's
So,
fake.
अच्छा,
No,
oh
no.
really? It looks real.
You know I make jokes. You know that I make jokes.
I know, I've learned now. Deadpan expression के साथ हकीम
And
साहब like is cracking up inside.
well, it's
How
lovely
are
to
you
see
doing?
you again, and I'm honored to be with Dr. Masuma and yourself and
Same here.
Dr.
And I
Veer.
look forward to a very in-depth discussion on this because I'm very fascinated myself.
Well, I mean, it's a pleasure to be in such great company, mashallah.
सेम ईयर, सेम ईयर।
Thanks, babe.
डॉक्टर मसूमा जो है माशाल्लाह उन्होंने भी टाइम निकाला, आप सबने टाइम निकाला है, इट्स एन ऑनर।
आपने बोला है
So, can you hear me clearly? आवाज सही आ रही है मेरी?
हकीम साहब आपकी आ रही है, शाजिया बहन आपकी कम आ रही है, डॉक्टर मसूमा की भी
अच्छा
clear।
अच्छा, मैं पंखा ऑफ करती हूँ, मे बी इसको पंखा है।
मेरी आपको सही आ रही है आवाज?
हाँ,
आप मेरे को
absolutely.
क्लियर आ रही है।
ठीक है,
अब
जबरदस्त,
मेरी बेहतर है पहले से?
बेहतर है।
बेहतर है, ओके, या इस पंखे की
अच्छा,
वजह से।
एक चीज है वो, ये अगर ऑडियंस वाइडर ऑडियंस है, ये सिर्फ पाकिस्तान की ऑडियंस है या वाइडर ऑडियंस है? क्योंकि
Yeah, that's what I wanted to ask you because I thought that we can paraphrase in English as well.
yeah, so
पूछ लेते हैं, is there anyone outside of Pakistan?
Well, I posted on my Facebook, and
Yeah,
somebody who's
so
a
have I.
student.
Yeah, so have I. Because quite a few of my students, who are non-Urdu speaking. Well, maybe they can
Yeah.
understand
It's
Urdu, but
England.
Yes,
ठीक।
from UK.
there's somebody from Bradford, so we'll have to speak in Bradfordian.
That's what I was thinking, that if people are comfortable and then kind of speaking Urdu, we can paraphrase as well for the benefit of
Mix कर लेते हैं,
people
I
who
think we just
can-
mixed it.
Mix. Yeah, mixing with Urdu
No, but
and
the
English.
people yeah, but the thing is, जब हम English भी बात करें ना, then for the sake of people who don't understand Urdu, like let's, you know, to me, just
So-
paraphrase as well.
Yeah, so maybe we can speak in English and paraphrase in Urdu or vice versa, whichever. It's up to you. You're the host.
No, because I want to know where your audience is. Is this primarily for Pakistan then?
So if you look here, so if you look at the audience already, there are people from Canada, from UK, from Pakistan. But I think most people will understand Urdu. I have a feeling apologies. Most people understand English.
Yeah.
So
Okay, well, if we keep English as the primary
Yeah.
language and
Yeah.
something needs to
Yeah.
express in Urdu, then we can do that as well. That
But-
might be easier.
Yeah, that's two. That's
What do you think?
that's. Is that okay
क्या
with Dr.
ख्याल है? Because
Masuma?
आप तीनों को English आती है ना, it's not like
It's fine.
Yeah,
must yeah, आप भी तो आला English बोलती हैं, तो फिर आपके लिए कोई मुश्किल
So let's do English then, and then with some paraphrasing.
Okay, all right then. So, is it already recording, or because I don't know?
Yes, it's recording, so we can begin.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh to everybody joining us today. This is my first time hosting. I've been roped into this by Dr. Adil, but I'm so curious to learn more about healing that I couldn't say no. So you just bear with me. Khush Amdeed, welcome to everyone. And what we'll do is we'll start off by finding out exactly what TIB is. What is the definition of it? How did it come about? And where was the need born for TIB to actually come into existence? So if we start with, who out of the three of you would like to start? I'll give you the option.
I nominate
About the origins of TIB.
डॉक्टर मसूमा या हकीम साहब, मेरा तो इतना एक्सपर्टीज नहीं है।
So if I may, أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. اللهم صل على سيدنا محمد. So I think the first thing is that, if I may, is that the word tib is just an Arabic word for medicine. Okay, so whichever medicine you practice, whether you practice Unani or Ayurveda, or you're practicing functional medicine, you're practicing tib. Yeah. Okay.
And so it's a generic word then.
No, it just means medicine in Arabic. That's it.
Okay. And so the Unani branch of that, what exactly is that?
So
We're going to
Unani.
start right from basics.
Yeah. Oh, basic. Okay. So as I said, the Arabic word for medicine is tib. And so if somebody practices tib, you're a tabib or a tabiba, meaning you're a physician, in effect. Now, and I personally prefer the title of tabib, because Hakim seems a bit grandier, meaning wise, suggesting some sort of wisdom, which I don't have. But then if you use those terms, because those terms mean things, and so in other words, when we say, for example, certain names in Islamic terms, they have power. Words have power. So that whatever names we've been given, they attain certain power. So we have to be careful with the names we use. The names have responsibility. Now, Unani is the Arabic word for Greece. So there are a bunch of islands around Greece called Iron Islands, and that's what the interaction with the Arabs were, and they call the Arabs call the Greeks Unanians, or people from Iron. And so why are they using this term for this medicine? Why Greek? Because the philosophy behind this medicine is Greek philosophy. So what happened was, you say from basics. So obviously, people have always been ill in the past, and some of the illnesses have been linked with spiritualism or magic or other stuff. So whichever part of the world there was. So the Babylonians, the ancient Babylonians, the Egyptians, these are ancient civilizations, and I'm sure in the subcontinents, the Indus, and China. So in the beginning, it was linked to people, sort of, the medicine was linked to people outside the extreme, because they had people who were outside the extreme, whether it was, for example, in China, people would go out to meet these people who were a bit strange, and they lived outside in mountains and other areas, and they would go to them, and before the medicine was codified. And similarly,
When you say codified, what does that mean? To people who would not
codified
understand.
is organized,
Okay.
organized and set in how it should be. Now, so if you talk about this part of the world, like meaning other than China and India, the Babylonians and the Egyptians were the original people who sort of said, okay, let's set this medicine and explain why people fall ill. So after the Egyptians, the Greeks came, the Greek philosophers and the Greek interaction, all these names, like, for example, hygiene, all that stuff, these are Greek gods and Greek terms. And so they would go to them and learn from the Egyptians, the Greeks learned from the Egyptians, and they created a philosophy of medicine to try to understand why people fall ill. So the philosophy, meaning, as opposed to the practical aspect of it, the Greek philosophers would say, people, this concept of 4 temperaments, 4 humors, elements. Similar thing happened in the Indian system of medicine and the Chinese system of medicine. So when the Arabs came to power in the 7th century, they found what was the medicine around at that time, and they found that the Babylonian system they translated, the Egyptian system they translated, a lot of the Greek philosophy, and the Indians and the Chinese, they linked with those systems, and they produced
So
something
there's
called
a
the Greek.
confluence of all of these, and this is an amalgam of all of that.
They collected them, and set them, and then further developed it. So then this was the medicine up to the 15th, 16th century. And then Western medicine, which I call Western medicine, practiced that same medicine, but then they started separating themselves from this system of medicine around about the 16th, 17th. Yeah.
Right. First of all, what I want to say is that Hakeem Saab is very modest because he does not own the title of being wise. But I met Hakeem Saab, and when I walked in the room, he said some of the wisest things about me that I have ever heard. So that's a disclaimer on his part because he's very modest. I'll say that for sure. And now moving on to our other guest, who is equally as wise in her own way, who's a phenomenon. And I only met her the other day and she's magical. First of all, I have to tell everybody that this is Tabiba Masuma, and Masuma in Urdu means innocent. And she runs a clinic which is called Inqilab Clinic, which actually means revolution. So for me, Tabiba Masuma is like Alice in Wonderland. She's a very magical lady. And as we get more into understanding how the three of them actually came into this realm, you'll understand that the three of them are very remarkable people. And they will tell their own stories. But Tabiba ji, tell us more about yourself now. Tell us more about your story. How did you come into Tib? और अगर आप उर्दू में बात करना चाहती हैं तो बेशक आप उर्दू में बात करें जिसमें आपका
Actually, in my childhood, I just wanted to be an artist. मुझे सिर्फ drawing, मुझको सिर्फ NCA जाना. And my father, he pushed me up because my family, my dada, my grandfather was homeopath, and he was a lifetime homeopathic Dr. Taqi Hassan. So he just wanted me to follow his footsteps, and he pushed me up. Homeopathic college में जाना पड़ गया, and I didn't wanted to study that. So I asked my father that if you say that I should study this, then there is कह लो एक शर्त मैंने रखी कि I want to be an acupuncturist then. And I knew he wouldn't allow me to go out of city, and it was a loophole कि मुझे कहेंगे अच्छा नहीं ये नहीं करती हो तो फिर तुम्हें पढ़ना पड़ेगा. तो मैंने उनके आगे एक शर्त रख दी. जब शर्त रखी तो वो मान गए. Unfortunate. I didn't want to be a doctor, but then I was pushed to be a doctor. So I started my journey with the homeopathic medical college in Gujranwala after my FSc. Then thank you to my father, he respected my opinion as well. मैं फिर लाहौर आई. I studied with my uncle, who was an acupuncturist and very renowned acupuncturist in Pakistan, Dr. Abbas Iqbal, who invented, now he's not anymore in this world. So he invented a medicine from Khake-Shifa of Karbala. It was a medicine for cancer patients. And he was well known in many places. He spoke about it. He gave seminars. He was very well known doctor. So my journey started there. Then I did my acupuncture. And after that, studying in traditional Chinese medicine, I thought and I was convinced that I love to find comfort and healing in herbs, not in homeopathy, unfortunate. Because it was the field कि जिसमें मैं push करके लाई गई थी शायद इस वजह से. So herbs को पढ़ने शुरू किया. फिर उसके बाद I did my Unani Tip from Tibia College in Lahore. After that, me and my husband, we both went to Sri Lanka for Ayurveda. So it was a beautiful journey of herbs which we started, and alhamdulillah, it's going on.
And the feeling I got about you when I came to see you was as well, you're very close to nature, mashallah. You know, Tabiba ji is very open-hearted. You know, when the minute I met her, I never felt like this is the first time I was meeting her. So she has a very open heart. And people like that, you resonate with nature. And I think intuition, what I gather, and I will ask you this individually, but seems to be very much a part of your assessment of people as well. That's something I picked up on meeting you, because with the three of you, it didn't feel like the first time I met you.
Sorry to cut you down. I believe if we can't give comfort to the patient, speaking about the patient and treating them, okay, in the very first consultancy, then we should not be allowed to treat them anymore. So I believe in, okay, if we can't read the patient correctly, then we can't treat the patient correctly. So
Correct.
we have to be with them. We have to be with them physically, emotionally. So, and yes, definitely we get 100% results के अगर हम उनके साथ involve हों, हम open hearted हों, हम बस डॉक्टर ना लगे.
Bilkul, bilkul. And you're, mashallah, the three of you are, even though you're all doctors, you're very, very humble and you're very approachable. Let's move on. We're going to go more into our assess kaise karte, aapko kya nazar aata hai in a short while. Let's move on to Dr. Adil, and then we'll go back to Hakeem Shahid Saab, and we'll ask about his journey as well. So, Dr. Adil Saab, aap hame bataएं, how did you end up in all of this, coming from Manchester to Lahore as well?
So, okay, so firstly, for me, it's a complete honor. I never imagined I'll be sharing a platform with Masuma, Dr. Masuma, Tabiwa Masuma, and Hakeem Shah Bukhari. For me, it's an honor. They are my role models. They are my inspirations. So, but how did I get into this? So my journey was back in 2012 when I finished my master's. My body was giving up. I had a nervous breakdown. I suffered from, essentially, I'll cut the long story short, I had heavy metal poisoning, which I got from my master's degree. So I was using a catalyst, which was basically a powder that was nanoporous. So it was leaching through my skin and it was sticking to my organs and it was destroying my entire body. So the NHS doctors, so I had chronic fatigue syndrome. I had psychomotor neuron retardation, which basically felt like there's an elephant sitting on my chest. And the doctors, after 1.5 years, gave up on me. They said, we don't know what's wrong with you, so we don't know how to treat you. And then I went to Harley Street. So most people know in the UK that, that's where your creme de la creme of doctors are based. And so I come from a family of medics. My father's an orthopedic surgeon, sister's a dentist. So we had the medical expertise, but no one was able to figure out how to treat me. So after going to the experts in Harley Street and them giving up on me, it led me to my journey to curing myself. I remember I went on Umrah. And, I would often pray that, because I was going through so much agony, I would pray that, if death is written for me, then Allah give me death. If death's not written for me, then give me a cure so I can cure other people that doctors give up on. So what happened after that? Because the only thing that I had left when the doctors gave up on me was the narration in Sahih Bukhari, that there's no illness that Allah has created except that He's also created its cure. So that was the only thing that was keeping me alive. And then Allah guided me to energy medicine, and then I treated myself with functional medicine, and I recovered in 6 months. So, and then when I came to Pakistan, I wrote my book, which I have here, The Ultimate Bioreactor. So there's
which I recommend. I think it sounds very fascinating story.
So that's I unconventionally ended up. So now I basically created a 3-step process where I heal people the way I heal myself, which basically involves bioenergetic testing. Then the second step is I optimize the diet and functional medicine. And then the third step is the mind conditioning, your habits and routines. So it's a 3-step process, which I used on myself when I treated myself when all the doctors gave up on me. So that's, in a nutshell, is my journey.
We'll go into more details about how the three of you assess, and then the individual kind of treatments that you do, to certain archetypes, examples of how you work. Let's move on to Hakeem Shahid Saab and ask about your journey as well into this.
Okay, so I took a bit of an unconventional sort of route in many ways. So basically when I was a child, okay, go back a little bit there. I used to come
15 years ago.
visit my grandmother and like give a jannah, and so I used to visit her, and then didn't used to go and see the medical doctors. She used to see these strange people that in this small place and a hut, and she'd
So where
go
was
and
this?
see
Where
them.
was this for us to picture? Which part of the world was
But
this?
this in Lahore, basically. So I used to visit my grandmother in Lahore, and she used to and in basically Krishnanagar, which is now Islampura. She used to this used to be Hakim there, and I used to visit him, and he gave these little small pills, and she'd see him, and I thought it was really bizarre. And I used to follow her around. I must have been about 9, 10 or something, and I used to think. And the thing is, she'd get better with these people, and then I said, Grandma, why are you seeing these people? I thought progress, and why don't you go to see these medical doctors and things like that? And she used to say to me, uh, that by seeing those people, she gets worse. And she used to say in Punjabi, she was from Amritsar originally, migrated from there, and she used to say to me in Punjabi, if I may, she said, bas cheer pardon. The cheer pardon, the mother, they cut you and rip you basically. And she said they fix one thing and make something else worse. So I thought, and then another event happened. I think my uncle, my mamu, so she had some issue with some urination issue at the time, which I know now. At the time, I didn't know, and she was quite in pain. And then my mum said, I would take her to one doctor, to another doctor, and all that stuff. And she kept saying, "No, I want to go see that Hakim, the other one over there, and some sort of Hakim." But he, kept took 2 or 3 different places, and in the end, he went to see this Hakim, and he said, "Bring your first urine, your mom's first urine, right?" So he took it, and this is him telling me the story. He took it, and then he put it in against the light, and he says, "Okay, throw that away." And he gave her some pills. He said, "Give her for 3 days." So she took the pill in the morning and the evening. She told my mom to come and see her. She said, "Come here, Adra in Punjabi, Adra." Right? And she slapped him on the face, and he goes, Beji, Maji, ki kar rahe ho? He says, "Why are you taking me to him in the first place?" Right? So unfortunately, when those games they've gone, they were like really wise. They would just give you see them once or twice, and that was it. They were amazing at games. So I thought to myself, when I grow up, I'll be like them. I had this little thing in my mind, and then as you grow up, I forgot. I took a degree in computer science a long time ago.
Very different.
Computer
That's
science,
a
yeah.
totally different thing from this.
I know. So I did that, and then I got this sort of really this. I worked for some famous companies, and then I got a job in America. I moved to America, but inside I was not happy and satisfied. And about that time I was about 30, and then I was there, and my wife, women have more intuition than men. Which I see that in my students, and I see that around men are a bit obtuse. I don't know how to translate in Urdu, but they're a bit. How would you translate it into Urdu? But obtuse meaning they're not. They don't,
Ghafil शायद है इस चीज से. Ghafil है maybe. They're
ghafil hai.
not aware.
Ghafil hai, but basically, women, many things my wife tells me, which she says, be careful of this or do this. And I think, how does she pick that up? But women have that frequency. Men don't pick up those things very quickly. Yeah. Anyway, so my wife she was used to support me, and that was, whatever you like to do, that's fine. I said, but she thought it was a hobby. Yeah. So one day I was working in Manhattan, making a lot of money. And but inside felt really empty. And I got on this train I used to live in New Jersey. I got on a train. It just take me an hour and a half. On the way, I decided to not go home straight. I decided to pray. Stopped over, went to a masjid, pray. And as we know, the different types of schools of thought in Islamic. We know we've got the Sufis, Wahhabis, Salafis, all sorts of, and Al-Shiri, and in all different. We have their own views of things. So this particular mosque was at a bit of an extreme view of Islam. It's straightforward. I won't say who it is, but so, and I belonging to the more spiritual background, and so anyway, I prayed, and then quickly, and then they had a bookstore. In the bookstore, they had this a book called Sufi Healing. So I thought Sufi healing didn't fit in that book, in that area. There was only one book. I thought I'll take, and he took the book, and I read the book. And it was literally about this big, and I read it on the way back. I got home and I was reading it, and then I was really fascinated. I didn't sleep. I read the whole book until I finished the book, and then in the morning, wife says to me, "What are you reading in that book? What's going on?" I says, "Oh, honey, this book is really good." She said, "Oh." Uh, she had an issue with menses, and she said to me, "Is there anything in that book for that?" And he said, in the book, he said mint and honey, mix them together, a tablespoon of honey and some dried mint. So I gave that to her, and her cycle started straight away. Right, and then that was my first, like, the moment where you're like completely revolutionary. So I thought, I'm going to find a way of getting.
It works. Yeah.
Yeah. But in my heart, I always knew there was something there. But I mean, later on in years, which I don't know, which you will hopefully come to, but and I can see that light in Dr. Masuma, and I can see that light in Dr. Adil. You can see, and I can see it in yourself as well. As soon as I saw you, I don't know, Allah gives us certain things, just like Dr. Masuma was saying, that as you walk in, as a client walks in, already you know what's going on.
This is what I find so fascinating. And I can honestly say, viewers, that when I walked in the room, the first thing that Hakeem Saab said to me is, "You are a mother." And I am very maternal, even though I don't have children. And then he gave me some very good advice, which really shocked me, because you don't know that person, walk in and they just kind of know something deep in your heart. So this is why I find this so fascinating, because the thing is, we don't vocalize everything we feel and we think. So you have a gift. You have a gift, that's for sure. There's no doubt about that.
The thing is, all of us have certain gifts. That the issue is, Allah subhanahu wa ta'ala gives us gifts, and it's mentioned in our books. The point is, you have to know them, and also use them to help other people. Whatever, it could be anything. It could be healing. It could be other facets. It could be engineering. It could be, doesn't really matter. Whatever it is, you have to discover that. And as a physician, for healing, for as a teacher, you should be able to in tune. If you're not, a lot of people are not in this field, are in this field that they shouldn't be. You see, so, and then I took the unconventional route in many ways. Unlike Dr. Masuma, I took the unconventional. I didn't go to a formal college in Pakistan, but I did study with many with colleges in the UK, and I took a diploma in Unani medicine with a college. It doesn't exist anymore. I studied there, and then I studied homeopathy. I studied Western herbalism, Chinese medicine, many other things over the years. But so I did that juncture in like 1999 or 98, 2000, that area, there was a revolution within myself. So that said, I wanted to do more than just what I was doing. And then then I went to Hajj, and I asked Allah subhanahu wa ta'ala, just like Dr. Adil said, I asked Allah subhanahu wa ta'ala for an opening. And then so I then, soon after that, a few months later, I found a place in Yemen, and where they practice, for generations. They call the Hive, the spiritually. They were basically, Ahlul Bayt were basically sort of mistreated over the centuries. So they fled from Iraq and they went into Yemen. Some went into other places, but they fled into Yemen. And so I was there with my children, and we were there for 4 years. And I believe
4 years.
4 years, yeah.
Oh,
Yeah.
that's
So
fun.
I believe that kind of washed me in many ways,
Well,
and
it's very
connected.
immersive, wasn't it? It sounds very immersive because you were actually in the world of tib. It wasn't like before. It sounds like you were compartmentalizing it. You know, because it was on the fringe in places like the UK. But then to
Yes.
go to a country that recognizes that and be part of something that takes it a lot more seriously, where it seems like a way of life, that must have been very transformative.
It's very transformative. That would need another program, separate one. But within me, there was a change. The people of Yemen are probably the best people I've met. And it's also part of the hadith. The Prophet ﷺ is saying that in difficult times, go to Sham, Syria. If not, then go to Yemen, right? So that was another reason why I went there. And it was a very, very important time for me. And then soon after that, I studied, not long, few years after that, I started getting into the practice of Unani medicine. Yeah.
Can I just ask you, because if we look at the parallels between Dr. Masuma and you, so you both you studied in different parts of the world, but in the Muslim world, do you think that helped to sharpen your skills?
Yeah, but we noticed Dr. Masuma left Pakistan and went to Sri Lanka to study. So the reality is that the Prophet said, go to China to study. So the knowledge, we have to travel for knowledge. You have to travel to knowledge. Knowledge doesn't come to you. You have to go to it. And it doesn't, and there are people in Pakistan that are hidden. And there are people in China, there are people in Sri Lanka, there are people all over. It's just that each of us has our own journey to make. Don't underestimate people from Pakistan and don't underestimate people from China. So they're all
This is
Indian.
going to be my next question. What would you say are the myths about tib and about Unani? I would call you healers. What do you come across that people have misconceptions about? मैं आप तीनों को यही पूछूंगी. Starting with you, Hakeem Saab. And I'll start actually, let's go to Masuma ji, and then we'll go to Adil Saab, and then Hakeem Saab. यहाँ क्या गलत फहमियां हैं?
देखो, अगर पाकिस्तान की बात करें ना, तो जो गलत फहमियां हैं वो बहुत हद तक ठीक है, अनफॉर्चुनेट. बाहर जिस तरह रेगुलेशंस हैं, यहाँ पे उस तरह से फॉलो नहीं किया गया कुछ सर्टेन टाइम पीरियड तक. अब तिब्बिया काउंसिल बहुत अच्छी तरह से काम कर रही है. दे आर वर्किंग वेरी हार्ड. यानी दे हैव मेड प्रॉपर रूल्स कि एफएससी के बगैर यू कांट स्टडी टिब. यू नो, there is a certain rule. But अगर हम देखें 20-30 years back, तो there was no rule. So the myth was, unfortunately, कई हद तक it was true that people were not so much competent over here. Not because the
even सुना तबीबा जी, मैंने even ये सुना कि लोग steroids डालते थे उनमें.
मैं ये बता रही हूँ, it's not because of the Unani tip, it's because of the colleges they are. It's because of the education they have taken, and वो पूरी तरह से उसको नहीं ले रहे. Then they switch to other medications and बहुत होता है. We don't deny over here in Pakistan because यहाँ पे टिब के लिए प्रॉपर स्टडी बहुत कम लोग करते रहे. अनफॉर्चुनेटली पिछले 20 years पहले की अगर हम बात करें, ये 10 साल की बात करें, ये अभी 5 years के अंदर काउंसिल बहुत अच्छा काम कर रही है. एंड दे आर मेकिंग रूल्स एंड रेगुलेशंस दैट हु कैन बी द पार्ट ऑफ दिस जर्नी, हु कांट. लेकिन उससे पहले तक जिसके भी नंबर नहीं आते थे और कुछ नहीं बनता था, तो दे वुड गो फॉर द हिकमत. अनफॉर्चुनेट. एंड दैट
एक अजीब सी phenomenon है.
Yeah, that was the baddest part, जिसकी वजह से थोड़ा हिकमत बदनाम हुई. बट यस, इसमें हिकमत का कोई कसूर नहीं है, यूनानी तिब का कसूर नहीं था. इट वाज आवर सिस्टम व्हिच वाज नॉट गुड. लेकिन अल्हम्दुलिल्लाह इट्स गेटिंग बेटर with the internet, with the facilities, with the online courses, and thanks to people like Adil and Hakeem Saab who are into it. They are bringing more valuable education over here. authentic education over here. यहाँ पे उससे पहले होता है काम, लेकिन वही बात है कि जिसकी खुद की हिम्मत हो वो पढ़ जाता था, और जिससे नहीं पढ़ना होता था सिर्फ डिग्री लेके गायब हो जाता था. So that was not a myth, unfortunate.
मुझे लगता है इसमें नीयत का भी रोल है, क्योंकि देखिए बहुत पहले वो माने भी जाते थे ज्यादा. People used to get authentic हकीम्स who maybe standardized process में से नहीं गुजरते थे, but they were genuine. लेकिन साथ साथ इस तरह के जो Machiavellian किस्म के जो charlatans जो कि बस ऐसे पोज कर रहे थे, and they were just taking advantage of it to make money. So it's a strange thing that even in the, you know, even when there wasn't standardization, there were still genuine authentic hकीम्स. लेकिन मौका परस्त लोग, people who wanted to take advantage of the situation, then came forward. So standardization sounds like a good change, है ना?
पता है बिल्कुल ऐसा ही है, लेकिन पॉइंट यही है कि जो अगर कभी कुछ ऐसा यूज करता भी है या करता रहा है, वो ज्यादा अरसे तक मार्केट में या अपनी जगह में नहीं रह सकता. सो इन द एंड ऑफ द डे काउंट्स. If you're doing a good job, if you are taking care of your patients, if you are doing your 100%, believing in that कि अल्लाह हर चीज देख रहा है, तो it gives answers definitely. So
And how do most of the customers come
कुछ
to you?
ecosystem भी है. In Pakistan में there is an ecosystem between a Unani or Ayurvedic or alternative medicine doctors and between conventional doctors. We have an ecosystem over here. The conventional medicine, they don't want to say किसी भी patient को कि this is not my case. First you have to go for an alternative medicine. But इसी तरह बहुत सारे हकीम हैं जो हम जैसे हैं, जो कहते हैं कि नहीं, गलत है conventional medicine. So what I believe, and I told you day before yesterday, I guess, है ना, कि there should be an inqilab over here. We should work together. Together, the conventional medicine and Unani Tep can do wonders. बहुत सारी surgical procedures हैं which are not present in Unani Tep or alternative medicine. Yes, उसके लिए हम उधर जा सकते हैं, but अगर इकट्ठे काम करें तो बहुत अच्छा रहता.
इसी को तो complementary therapies कहेंगे ना फिर, that they both help each other, balance each other. And I think आजकल के दौर में जहाँ mechanization है, over medication है, this is a very ये एक बहुत अच्छा initiative होगा अगर रुझान इस तरफ आए, because everything's moving towards plasticity. And उसके भी अपने
ये रुझान आ गया. जिस तरह मेरे पैनल पे मेरे साथ बहुत सारे मेरे कन्वेंशनल मेडिसिन के डॉक्टर्स हैं. दे आर गायनेकोलॉजिस्ट विद मी, दे आर स्किन स्पेशलिस्ट विद मी, एंड डॉक्टर अदील नो मोस्ट ऑफ देम एज वेल. तो दे आर मतलब आप वो कन्विंस होते हैं. अगर कोई अच्छा हकीम होगा तो दे आर कन्विंस्ड एंड दे नो के ऑल्टरनेटिव मेडिसिन काम करती है. एज हमारे पेशेंट्स वो बन के पेशेंट्स आते हैं, देन दे मूव ऑन विद मी, और हम इकट्ठा काम करते हैं.
And I think recognizing, honoring, and respecting that is very important. Another question I wanted to ask everybody is about, you know, जब एक typical patient आपके पास आता है, and we'll go to Adil Saab first with this one, like what tend to be the symptoms and where do they come from? Like, is it personal issues, family issues, spiritual issues? What kind of things do you come across? हम rotate करते, फिर we'll go to the three of you one by one. But if you things up.
Okay, so my experience is basically is a model which I work on, is a framework that basically everything in this universe revolves around 4 dimensions. This is a conclusion I came up to when I was roughly 15 or 16, when my grandfather passed away. I was going through a period of depression, and I was sort of contemplating what is this universe composed of? What are we as humans? And what I realized was that there are 4 dimensions. There's a physical dimension, there's a mental dimension, there's an emotional dimension, and there's a spiritual dimension. So जब भी मेरे पास कोई मरीज आता है, when there's a new patient that comes to me, I actually analyze, is it a physical issue, is it a mental issue, is it an emotional issue, or is it actually a spiritual issue? So I'll give you an example. The new clinic that I work at, because I said to them, मैं वही patient देखूंगा जिनको doctors जवाब देते हैं. So I'll only take those patients that doctors give up on. That's the criteria that I said. And someone suggested a patient who basically as soon as he walked in, I knew it wasn't physical. I knew it wasn't mental. I knew it wasn't emotional. I knew it was a spiritual case. I knew it was linked to magic, and I knew that it was a case of possession. Now, the thing is, his father sat down and he gave me this big, list of files that they showed, I think, 68 psychiatrist consultants in Pakistan. And they came to the conclusion that there's something that we can't figure this out. And I said to them, so I gave them back the fees. I said, this isn't in my domain, but I can guide you to someone. And I said, this is a spiritual issue. And Alhamdulillah, now the kid, he's fine now, after 3 months. But I'll tell you, especially mental health, this is a huge issue. I'm someone that I share that, like I shared with you, I've been through that ordeal, when I was in the UK. So because I've been through that, I can, make that analysis, or that other people are unable to, especially medical doctors. So
you're an insider, you have that insight to recognize the red flags that maybe other people don't understand.
It's insight, is more perspective, your perspective is built up of 4 things: your knowledge, skills, experience, and exposure. Because I have a bit of knowledge and the skills and the experience and exposure, I'm able to, the intuition tells me that which dimension is the problem at. And then I address it accordingly. So, for example, if it is spiritual, then I refer it to spiritual specialist. If it's emotional or mental, then or physical as well, then I use because my specialty is biochemistry. So I use functional medicine to address it. So, for example, if there's a patient with depression, I would see which layer is the depression at. Is it neurotransmitters? Is it the neurochemistry? Or is it actually negative trapped emotions? Or is it actually...
So when you say neurotransmitters, is that to do with biofeedback and behavioral?
Yes.
For people who don't understand what that is, can you just explain that a little bit more?
So basically, you have different hormones or brain neurotransmitters, such as serotonin, which is linked to happiness. You have dopamine, which is linked to focus. You have endorphins, which are released, when you're, for example, when you go for exercise. So there's basically your neurochemistry, and oxytocin, which is linked to relationship and bonding. So your neurotransmitters link to your moods, your emotions. Now, the issue is, how do you determine whether it's a neurochemical issue, or whether it's an emotional issue, or whether it's actually a spiritual issue? Now, this is what differentiates a good physician from a great physician. Because a great physician, like Masha Hakim Saab and Dr. Masuma, they're amazing physicians. They can tell you straight away just by looking at a person. I'm not as good as that. So I have to fill in a form, which takes me roughly half an hour, and I capture the data. Then based on the analysis, then I draw a conclusion on what I believe the case is. So that's what I use. I've created my own framework for that.
No, I think you're being very modest. The thing is that the 3 of you operate on different levels in different dimensions, in the sense that you all have a skill, but how it plays out are your individual gifts. Because you, like you said, you were able to detect that very astutely. So again, you're another person who's very, very modest, mashallah. You have that ability, and let me tell everybody in the audience that Dr. Adil, mashallah, is a pioneer in so many areas. Mashallah, he's launched a company called Mist, which is for water, which is alkalized, and I'm going to ask you more about that later on. And the proceeds of that water actually go to help Palestinians. So he has a big heart, just like Dr. Masuma and Hakim Shahid as well. They are, having sat in the same room with the 3 of them, I can honestly say one thing that the 3 of them have in common in terms of what I understand to be the archetype of healer is, they all have a big heart. They're very generous with their spirits. They're not clinical, even though they can operate in the clinical realm in order to obviously make assessments, but they do things with their whole heart. And that is something that for me is very remarkable when people are looking for careers where they make a quick buck. The money side of things is not the main thing. It's the satisfaction of healing. And that's something that I think, when people come across people like that, half of the healing is having met people like you. you know, that you're not mercenary. You are about the healing, just like Masuma said as well. You've got to love what you do, and I see that about all three of you, mashallah. So okay. So you've mentioned about the spiritual side, the neurotransmitters, the hormonal, and let's move on to the emotional. Tell me more about that.
The emotional side, I think Dr. Masuma will be better equipped to that, but I'll just share my experience on that. There's a book called The Emotion Code. So I'll give you an example. When I used to do life coaching in Banigala, there was a student of mine, and she was sat and she discussed how she had a family history of liver tumor, liver cancer. And I was just listening to her, and I said, "Do you also have a family history of anger?" And she stood up, and I actually didn't ask her. I told her, I said, "You also have a family history of anger." And she stood up straight away. She goes, "Aapko kaise pata?" And the reason was because your organs are linked to emotions. So, for example, your liver is linked to anger, your kidneys linked to fear. You know, people that worry a lot, it affects the digestive system. So, according to research, those people that have stress, that experience anxiety, the first set of cells to be destroyed in your body are your intestinal cells. So your stomach lining is the first cell that begins to deteriorate. So your emotions have a link, and there's a wonderful book called The Emotion Code, where basically, you know, they're healing people by healing emotions. And there's another research linked to that, which is by Dr. Misuro Imoto, who basically did research on water crystals. So your body is 60% water. And the words that you speak, the energy that you emit affects the person who's surrounding you in. It affects their body. So, you know, mashallah, you know, when you go to Inqilab Center, you get that, you feel that energy of healing as soon as you walk in. You know, because mashallah, you know, Dr. Masuma has created that environment, and she releases those frequencies that, alhamdulillah, lead to healing. So emotions have a huge role to play, especially in females, because females absorb emotions much more than men. Much more than men. Over to Dr. Masuma.
Yes, definitely. You're 100% right, because in our field, specifically in traditional Chinese medicine, we believe that this psychiatric department, it's just the alarm system of the body. If somebody is fearful, we have to look after the kidney and the bladder function, the reproductive organ function. And if somebody in anger, jaise Adil ne bataya, it should be looked after the gallbladder. The worries and जो ज़्यादा परेशान रहते हैं, worry रहते हैं, तो उनका usually gallbladder में stone जरूर होता है. ये वो चीजें हैं कि that should be addressed. Whenever patient comes to me, what I do is I read their pulse, I decide their dosha, what is their dosha or body type. According to that, I have just made a chart for myself, combination of the 5-element theory, combination of Ayurveda and Unani Dev. So, either se pakre ya udhar se pakre, it's the same thing. If we are saying the uzlati, it's the dryness. It's the same in Ved. It's the same in traditional Chinese medicine. So, मेरे diagnosis का तरीका क्या होता है कि I just show my patient the chart. I make them believe. I tell them that this is what is going on in your body. Or yes, they are most of the patient, they get fascinated. Pata laga. So it's a big science. You have to read the patient according to the pulse reading. Uske against we treat them. Jahan se emotional side hai, for the emotional side as well, we have to treat the organ. Let's suppose once there was a patient, they came in with like history of fear, and it was a mashallah grown up man, 23 years ka bachcha tha, and the parents bring him, जिसने उन्हें बताया कि ये पिछले 3 years से सो नहीं सकता प्रॉपर, डरता है, he can't sit टांगे नीचे करके, because he has a fear that somebody is behind him, somebody have to grab his legs. So I just tell them कि जब जाओ and bring his urine complete examination, because उसकी पल्स बता रही थी कि UTI होगा इसको. And I took the history, जिसमें उन्होंने बताया कि when it started, he went to the mountain area for 3 or 4 weeks. He came back, और वही जैसे चलता है कि कोई जिन भूत पर चिमट गया, क्या हो गया हमारे बच्चे को, 3-4 कंसल्टेंट के गए, 3-4 दम दरूद के गए, and then they came to me. And his father was like bit angry because वो अपनी बीवी के कहने पे बच्चे को लेके आया था. And he said कि मतलब आप इसको ट्रीट करें, यूरिन का क्या करना है आपने इसके, you know, people really believe in. मैंने कहा okay fine, if you are, usually I tell to my patient, if you want me to treat you, you have to surrender, you have to listen. If you want to do your science or believe your science, then you are very happily you can go and treat yourself. तो वो उसने जाके टेस्ट कराया, बच्चे को कोई सिम्टम नहीं थी बज़ाहिर, लेकिन it turned it to be कि numerous pus cells थे, and I just treated his UTI with the herbs, nothing else. I did the acupuncture for balancing the energy, the ghost points you might be knowing, the ghost points वो 4-5 किए जिसमें emotions उसके stuck हुए हुए थे, and he was fine in 3-4 days. So yes, emotionally जब भी treat करना है तो we have to treat the organs.
And it seems we're all linked, the body mind spirit connection. Lekin I think people, especially men, I mean, I discovered this from film school when I was learning screenwriting, that expressing emotions for men is a lot more difficult because society, even though it's changing, there's not a space for men to be as emotionally vocal or demonstrative. And so that I can imagine, and something I want to ask three of you later on is, are there typical symptoms and complaints that people come to you with from each gender? You know, is it something that, you know, you can predict? You, because आपका अब इतना experience हो गया कि मर्दों के like हवाले से इतनी तादाद के मर्दों को ये होता है मेरे patients में से, and ख़वातीन का भी के हवाले से भी, because some things seem to be societal, because of societal pressures and their role in life as well, in the family. So do you find that, Dr. Masuma, that मर्दों के कुछ patterns हैं, जैसे आप बता रहे urinary tract infection, that could be from fear, not inability to express?
Yes, मर्दों में yes बहुत rare, कम, इतनी ज़्यादा नहीं होती जितनी ख़वातीन में, because they are living in the fearful environment. It's a vice versa thing. ख़वातीन में they have more joint pains, more knee joint pains, and according to 5-element theory, kidney, bladders look after your bone, teeth and cartilage. और उसका emotion is fear. So living in a fearful condition, yes, उनकी कमर में दर्द होगा, उनकी घुटनों में दर्द होगा, उनको UTIs होंगे, majority. इसी तरह मेल में अगर चले जाएं तो the pressure they are going through, the family pressure, the financial pressure and everything, उसमें again मेल में आपको backache बहुत मिलती है with the cramps and spasms, क्योंकि वो आपका economical side होता है, आपकी जो कमर है वो टूट जाती है ना, क्योंकि लफ्जों में हम ये बोलते हैं. सो आदमियों में एसिडिटी मोर बिकॉज स्ट्रेस ज्यादा है, एंजाइटी ऑफ फ्यूचर होता है, क्योंकि उनको फ्यूचर का फिक्र ज्यादा होता है, तो उनमें एंजाइटी वाले एलिमेंट जरा ज्यादा आते हैं.
अच्छा, जो मैंने समझ लिया ना, चक्रा से सोलर प्लेक्सिस पेट में है, and that's the place about security, isn't it? तो इसलिए ये है कि पेट की इश्यूज ज्यादा है मर्दों में. Dropped. Hello.
I think you lost.
Maybe Hakeem Saab can shed some light.
I think you lost Dr. Musuma, but she'll connect. So, okay, I'll just carry the baton basically. I think you said earlier, I just want to just touch on something you said earlier about you know, people have a negative image of Tib or Unani Tib, for example. I wanted to just address that as well. It goes through all professions. Yeah, Western medicine also has a bad reputation as well. So a lot of people, there are a lot of people who sort of mistreat, and we've had a lot of deaths and other issues. If we had, their insurance is very, very high, because they have a lot of issues with their medicine, but
Risk
because
factor.
risk factor is much higher. And ours is a very conventional sort of a natural medicine is much way more safer. Obviously, you get people who are misusing any system of medicine, can be misused. Okay, so I think that's the other thing that I think Dr. Adil touched on and Dr. Musuma touched on as well, is that we have three levels. The way we describe this three levels is the physical ailments, the emotional ailments, and spiritual ailments. So in my experience, majority of people have emotional issues, which then manifest themselves into physical problems. Okay, and I think somebody in the group asked a question about why is the rise in thyroid. For example, the rise in thyroid, because if you notice, the thyroid gland of a woman is larger than a man's, roughly about a third larger. Now, there's a reason for that. It's because we have an Adam's apple, this thing here, and that's why so the organ of a woman's thyroid is larger, but her bladder is smaller. The bladder has to be smaller for the room for the uterus. Okay, so this is the voice box, isn't it? As well, where the thyroid sits is where the voice box is. So it's believed to, in terms of emotionally, is a suppression of emotions. Yeah, and that's why there's more women who have thyroid issues than men. Now, the other thing is that it's also to do with food, and there's a rise of issues with food and what they put in the food, which is a whole topic about what's going on in terms of our diet and things like that, and iodine levels and things like that. So, so I just want to just address those points. So there what was the other question you was asking? Sorry, apologies for that. Was another question you was asking?
Yeah, I was talking about whether some symptoms are gender specific, but I think you've answered that beautifully because you explained about the Adam's apple. That, yeah, but if we can move on to about society then and societal pressures, I find it interesting that you said that most of the problems are emotional.
Yeah, they are.
And especially, I think that's surprising being in the Western world, where people in the East, in the third world countries, think, oh, once you move to the West, everything's so great. You feel happy all the time. So this is something that I am interested to explore with you to find out why is that case? Because obviously you get to analyze their lifestyle and the reasons behind those emotions.
Yeah. So the thing is, it's as I said, just to get Dr. Musuma up to speed, we talk about emotions. The emotions are in my personal belief, emotions are the key to most of the illnesses. And I think because being Eastern people, we like stories. So, I come from a family, of what we call quote unquote peers. Yeah. My grandfather and people before that. Yeah. But my grandfather was the last person who did that. He didn't allow my father and my uncles to, to get into for various reasons, because it became some sort of money issue involved around that. So he didn't believe in taking money for that type of thing. But anyway, so we still had some distant relatives doing this, and I grew up very skeptical about those things, and my father instilled that in us. So we used to go for, I would say, dare I say, when I was younger, I was a little bit more naughty, I suppose. But then we used to go to these people and see just to sort of see, oh, what do they do? What do these people do, and all that stuff, just to kind of like sarcastic questions and all that stuff. So I went to see one of our person, and I said, what do you give these people? What do you actually give them? You give them these things, and what do you actually give them? Just to speak, shouldn't have done that, but we should do that. And the thing he said to me, one of my sort of distant relatives said to me that better I give them hope. Right? So the key to, for example, Dr. Musuma, or the key to Dr. Adil, or the key to yourself is hope, giving hope, right? And when they come, and if that links back to what Dr. Musuma said about and Dr. Dale said about the kidney issue. Thing is, if you observe, we're giving you the tricks of the trade here. If you observe somebody walking into your clinic, see how they walk. So when they walk and they're walking like this, we know there's some issues with the bladder. We know there's issues with kidney issues because they're going to be stooping forward. Yeah. Okay. And when I'm training my students, I tell them, so they say, oh, after seeing the case, they say, I want to give them this, I want to give them this, I want to give them this. And I said, well, no, give them this. They said, why? I said, the client is telling you what's wrong with them. They're telling you, they're literally pointing to the area where the problem is. So it's within you, within your inside, there is a healing power that we have. All the Unani physician, all the functional medicine physician, or the homeopath, or whoever you are practicing, all we're doing is kind of helping what's inside to fix
Fine
this up.
tuning. You see, there's something else.
No. Not even fine tuning. Not even fine tuning.
No.
No, we're not fine tuning. No, what we're doing is there is a healing. Okay, for example, as I teach my students, you cut your finger and then you put a tape on it or a bandage. Yeah, is it the bandage that heals you or something else? Yeah, it's something inside you which heals you. So if you go like Dr. Deal was saying, he fell ill. He went to Harley Street, spent £3,000, and he still didn't get better because all they were doing was suppressing his immune system. Which we call they call immune system. We call it tabiat, right? What we're doing is we're just helping it. That's all. Yeah,
Giving it a nudge.
We're not suppressing it. We just guide it, right?
I think with a lot of conventional medicine, it seems to be about dumbing things down. It seems to be about suppressing is the right word, about bringing things into control rather than allowing things to flourish.
Yes.
And what you seem to do is jumpstart the natural process of healing.
It is jumpstart or supporting, as Dr. Musuma was saying, that person came in with an issue. The thing is, that thing that what she's observed, it's something different. So whether it's Dr. Musuma, whether it's Dr. Adil, we follow a process. We have a piece of paper. Some of it's in here, some is a piece of paper. We write it down. I tell my students write everything down. But then it's being detectives and being aware what's going on with that person, and that it's like, okay, so what makes a good physician? Whether it's doesn't matter which one, homeopath, functional medicine, Western medicine, doesn't matter. You got it's like an athlete. Okay, so if like when I was younger, I used to love playing cricket, and I used to miss my studies. I used to play all day, all night, and then whichever sports I was into sports, I was fanatic about it. My father said when I was missing my studies, I came home, my father said to me in Punjabi, says, "Ya tu for Imran Khan ban ja, ya pray kar, right?" I'm never going to be Imran Khan. Yeah. So what I'm saying is, but Imran Khan or whoever played it is, he has a born ability. Nobody can be like that person or similar, whichever profession, sports people, they have the ability, but then he works on it as well. So it's that. So Dr. Musuma has a born ability. Dr. Deal has a born ability, but they work hard.
1% inspiration, 99% perspiration. And I know that all three of you work extremely hard. You have very hectic schedules, that's for sure. And something that has occurred to me about all three of you, which I think is key, that you don't often find in a doctor's surgery, and that is sensitivity, almost to the point of hypersensitivity. And a lot of patients that come, I'm not surprised now speaking to you that they have emotional issues, because I think maybe they suffer from not being seen and heard and validated. And when they come to you, they get that feeling of actually being validated for the first time. It's a safe space that you create where you're looking at them holistically as opposed to what they have to do. The difference between being a human being and a human doing. So you're seeing them as human beings as opposed to that function.
Yeah.
And that allows them to then look at themselves differently.
Yes.
Because the experience of speaking to you is
I-
different from speaking to conventional doctors. Sorry, Jia.
Hakeem Saab elaborated very correctly and 100% right that we give hope, I guess. And that hope do wonders. Last month I just treated a patient when she came here, she is 24. उसको कभी periods नहीं आए थे because her ovaries and uterus was non-visible. In conventional medicine, उसको तो बोल दिया कि just अपनी बच्ची को पढ़ाओ लिखाओ and make sure कि जब इसकी शादी करो तो किसी ऐसी जगह जहाँ पे उसको औलाद ना चाहिए, because she is not capable of that. मेरे पास आई तो जैसे always I say कि we the holistic science specialists are the last hope for any person. Specifically after Dam Darood, they come to us.
Yes.
Yeah. And they want miracles to be done. Okay. I just asked her and I told her mother that, listen, I don't know what will happen, but I do कि Allah ने हर चीज का इलाज बनाया. So let's try. And I did. According to the 5-element theory, I detoxed, took care of lungs and large intestine. I nourished kidney and bladder, liver ko nourish kiya, cleanse kiya. And it took 1 year, mashallah. Ahista, what's told, ek dafa, do dafa, teen dafa, the ovaries were in good size. They are in good size now. And mashallah say, and being a holistic science specialist, I would say this is the unique treatment I have ever done. Because वहां पे मैं भी उसमें नहीं थी कि पता नहीं होगा कि नहीं, बट वो इतना रो रही थी कि मैंने उसको उस वक्त सिर्फ होप दी, नहीं कुछ नहीं बात है, सब ठीक हो जाएगा, इट विल बी फाइन. और मैं उसको 1 साल होप देती रही, और उस होप के नतीजे में कह लें अल्लाह का फजल था, अल्लाह ने इज्जत रखी कि यूट्रस का साइज इज नाउ नॉर्मल, हर ओवरीज विजुअलाइज्ड. डेफिनेटली अभी फॉलिकल नहीं है, द सिस्टम इज नॉट वर्किंग करेक्टली अभी तक, बट अल्हम्दुलिल्लाह शी इज मैरिड नाउ. अम्मा खुश है, वो बच्ची खुश है. After 4 months of my treatment, she had the very first period in the age of 24.
MashaAllah.
2% Hakeem साहब की बात बिल्कुल ठीक है. The hope it works.
So the thing is, जो आप कह रहे हैं, you see, that's our secret ingredient. जो secret ingredient ये है कि आप बता रहे थे, we'll share with you, Shazia, our secret ingredient for all 3 of us is के the duas that people make. And
the 3 of you are very spiritual people. I know that.
Yeah, every patient, every person I see, I'm not lying, wallahi, it's truth. I feel that I don't know anything. I really don't. In fact, I actually know this much. I literally know this much. And if that. And there are people who know a lot more than me. Yeah, I have people who have been my teachers and they've seen them and they came to see me afterwards. Yeah, so it's basically, I'm actually thinking, am I going to be able to help this person? Dr. Musum has given one case. There are many cases, many cases that I've seen that I think this person came, she was 17 years, no child, and then she said she was within 6 weeks she got pregnant. Yeah, and I was thinking just like Dr. Musuma, what could I do for this person? And I went to get this medicine and Unani medicine, and then my hand shifted to a Ayurveda medicine called Kunch. We were using Unani as well. And I gave her that, and she was pregnant, and I was surprised. So it's healing is Allah's hand. We have actually no power, literally got no power.
I actually have a friend who had 3 miscarriages, and then she was recommended to Sufi mystic to go and see someone for treatment, alternative medicine. And then she did get pregnant and she's had a son. So, mashallah, there is, I think your intentions yes, I do believe that it is beyond knowledge. Your intentions, you're like vessels for healing.
Yes, absolutely.
Yeah, and I think it's an energy, a frequency that you give out, because something I felt meeting all three of you, and I've only met you, in the last month or so, is that being in your company is very uplifting, and it's not something that is manufactured. It's not fake. A person feels safe with you. It's not that everything has to be serious all the time. You can laugh, but you can be your whole self. And I think one of the things in society is where we wear so many masks, we have so many responsibilities, we are expected to behave a certain way. You're a statistic, you're a gender, you're this number in the family, you're expected, that people get weighed down by how they're supposed to be. So when they come to somebody like you, they can be vulnerable and be open, and that allows new ways of thinking and doing. When often you find you're stuck in the same rut. So that is something, mashallah, by the grace of God, that you have, that you treat everybody with a blank slate. You allow people to not be to be disarmed in your company, and that is something you can't fake. Because I'm a very intuitive person. When I meet someone, I've said this to Dr. Masoom the other day, I instantly know if I'm going to get on with somebody or not. And accordingly, then I behave. If I know it's just an obligation and I have to go through it and be polite, then I behave in a certain way. If I feel free and I feel relaxed, then like when I met Hakeem Saab with Adil Saab, then we sat for a couple of hours and the time just flew. It's something, it's about authenticity and coming back to your true nature, your fitra. And an awful lot of people are actually dislocated from that because of the malady of modern life. The pressures and the financial aspect, people are chasing, they want more. I went to Emporium Mall once, and just by the lift it said, make more money so you can spend more. If that's your philosophy today, then you are going to fall ill, because it's a mechanized life. It's not embodying the different aspects of yourself, like you're saying, the body, the mind, and the spirit. It's not allowing for them to stay in balance. It's taking it down one route where, of course, as a consequence, others will suffer. So what I'd like to ask you now is, can you, each of you, offer some tips to optimize health? And for anybody who wants to actually go into learning about Unani Tib, what advice would you give them? So who would like to start?
Oh.
Okay.
Tabiba Masooma, aap shuru kar lijiyega.
Of I would say how to live is सबसे बड़ी चीज I would always say to my patients, eat and drink of region and season. If
Stay within the flow of nature.
If you're closer to your region, you'll not be feeling sick anymore. Because over here, we say कि coffee के बहुत फायदे हैं, and you can have lots of benefits from coffee. But if taking coffee in the season of Punjab can make a big difference. It can lead to high blood pressure. It can lead to piles, bleeding piles, and all that. So the basic tip I always say, eat and drink what is the best in your region and season, not out of season as well. So Allah knows the best. Okay, if somebody is living in the plain area, somebody is living on the coastal area, उसके लिए क्या जरूरी है, क्या उस पे वहां चाहिए. Let's suppose in coastal area we can find coconut in a larger amount, but in plain area we can't find the coconut. So coconut oil is not for the plain area, it's for the coastal area. And again,
जमीन से जुड़े रहना, इस जमीन से जहां आप हैं,
मिट्टी के साथ जुड़े रहें, मौसम का खाएं, मौसम का पिएं, और कोशिश करें कि to follow the tip इस तरह से कि जो सबसे सस्ती सब्जी या फल आपके मौसम में मिल रहा है, that should be more in your diet for those few days. So preparation उसी से शुरू हो जाती है for the next season. Let's suppose अभी आम आ जाएगा, जब आम आएगा तो अभी खाने से नेक्स्ट सीजन में वो आराम भी देगा. ऐसे ही तरबूज अभी आया है, तो आगे जैसे ही सीजन में ज्यादा गर्मी आ जाएगी तो उस वक्त वो तरबूज काम देगा, क्योंकि उसके अंदर से वो जो वाटर कंटेंट हमने ले लिया है, अगर हम ज्यादा लें. दैट्स व्हाई आई ऑलवेज से टू माय पेशेंट, इफ यू कैन सी द पीपल हु आर नॉट प्रिविलेज्ड, द पीपल हु आर लिविंग इन द विलेज, they have more immunity. They are, because they are more closer to their region, their seasonal food and fruit. And the people who are privileged and they can have everything, their immunity is zero. It's just because they want to eat what their heart say, not what is their need. So I think this is the main tip that should be followed.
तो ख्वाहिश और ज़रूरत में क्या डिस्टिंक्शन इंसान को समझना चाहिए. You should know the difference between what you desire and what your body actually needs. This is very interesting. जहाँ अब imports बहुत आ रहे, there's a lot of things that actually are imported into Pakistan that come from far away and they're frozen, and they're given a lot of things coming from the US, from Brazil, and you see them also going off more quickly. And so this is actually testimony to the fact that you are getting it, live simply, and it might be of more benefit to your body.
आप देखो, जब कोविड पाकिस्तान में आया तो सबसे ज्यादा डेथ्स उन एरियाज में हुई कि जहाँ पे जो कि प्रिविलेज लोगों का एरिया था. कोविड ने बहुत कम हिट किया गांव में, बस्तियों में, बिकॉज उनकी इम्यूनिटी स्ट्रांग थी, और वो सिर्फ इसलिए कि they can only afford to eat the fruit and the vegetables which are more in market and which are cheaper. So Allah knows the best how to handle our body, how to support our body through food and fruit, और उसने हमें दिए, and that we should have to like see.
I mean, this exemplifies the myth that sometimes no choice is the best choice. लोग समझते हैं बहुत सारे options हैं, तो उसकी वजह से खैर ही खैर है, लेकिन हो सकता है कि इसमें हमारा नुकसान हो. That the more options you have, sometimes the more that goes against you in the long run. So
I would agree with Dr. Masuma that first of all you should eat food, especially food that's grown in the soil, in the areas where you are, because there is an antidote for you in that area, whether it's jariyan bootiyan or herbs or food or everything. So if you're in England, for example, they should eat the potatoes from England, not shipped from South Africa or South America, whatever. You should, because it contains an antidote for your area. Generally speaking, that's a rule. And the other thing is, I think Dr. Masuma is 100% right, because it goes back to our hadith, the Prophet ﷺ. Really, the problem is we're overeating. So when you must have heard this saying many times in the mosques, and the Maulvi Sahib is telling you about, you can eat 1/3 water, 1/3 air, 1/3 food, but he's being a little bit naughty because he's not giving you the full hadith, because actually it says 1/3 is the maximum. Originally, Prophet ﷺ said that it's enough for the son of man to live on 1, 2, 3 morsels. That's it. But if you need it, then you can have up to 1/3. Yeah. So at the moment when we eat, Ramadan, when we khana kha rahe, we're eating it, we almost food is coming out because we're burping when we're praying because we eat so much, right? So food is your enemy in some ways. It can harm you. It says in our books of the books that basically they can, food can heal but also harm. So eat less is a secret. And
live
eat
more
locally and less. Yeah, really. When I was my uncles, they were, mashallah, they were very healthy, and and I said to them, I said, Uncle, what secret thing did you guys eat when you were young? Because I wanted to give it to my my patients. I said, what is it that? And he looked at me and said, Peter, We were always hungry. We didn't have any. We didn't have no food. I said, "But how
Oh.
much meat?" Yeah, he said we would have meat in meat when there were like events or weddings or some function, and maybe I says, "Well, how often?" He says, "Maybe an average once a month we would have meat, and we would have maybe I don't know if you know Iqbal is like 250 grams or something like that, roughly, of for the whole family." And and in other words, and they would eat, suki roti, the dry roti with ghee on it, and that was it. Nothing else. And and they lived very healthy, mashallah. And so the food is killing you. That's what Dr. Muhammad had to tell us.
Overindulgence. Yeah,
No,
overindulgence.
food is killing you. I mean, if you look at the lives of the Prophet's companions, or if you look at the lives of the Sahabas or the Prophets, they lived on one date, and they went to war. They went to war on one date.
Very true. The resilience and they're very robust. That iman was so high as well.
Yeah.
So I mean, all of these factors do interplay.
Tells you with that infinite frequency.
Sorry, Dr. Masoom, आप कुछ कहने लगी थी.
आप बिल्कुल ठीक कह रहे हो. ईमान वही बात है जैसे हकीम साहब माशाल्लाह ही saying that empty stomach brilliant brain के साथ होता है.
बिल्कुल सही. Very true.
क्या वो शैतानी कुव्वतें लेके आता है.
बिल्कुल.
दिमाग भरा हुआ, पेट भरा हुआ.
बिल्कुल. और दिल भी भर जाता है फिर. थोड़ा सा पेट खाली हो.
हाँ बिल्कुल बिल्कुल. पेट भर जाए तो दिल कभी नहीं भरता.
Never. वैसे अच्छा देखिए, डॉक्टर दिल खामोश हो गए, क्या वजह है? डॉक्टर दिल ना बात कर रहे हैं, और the other thing, are we
We
opening
haven't
up,
given Dr. Adil a
and
chance.
also
Yes.
are we opening up questions to the audience? So
Yes, but if we ask Dr. Adil's opinion on this before we go to questions, Dr. Adil, what's your take on all of this then? Because I know that you have your own kind of a medication range as well, don't you? Tablets and things like that.
Yeah, I was so immersed into the amazing insight and wisdom of Dr. Masuma and Hakim Saab that I've forgotten the question. So if you could repeat the question, then I'll answer. So what was your question?
Sorry.
she's frozen.
Okay. Oh, sorry. Yeah, in all of this, the body-mind spirit connection and food and the quantity of food and how you should eat it, because I know that you do advise people about you have your own range as well of nutraceuticals, don't you? How big a role does food play into it, and what are people's eating habits that you've noticed here?
So it's very interesting because you know what, Iqbal said something amazing. Allama Iqbal, he said, Shariat ke paimane jo humne tode, Maghrib ne jaake jode. So basically the Shariats, the composition, that we broke, the West went and, compiled. So one thing that Dr. Musuma Hakim Saab were mentioning is hunger. And, there's a fascinating research that's being done on fasting. And it's a balance between need versus greed. What your body actually needs, and we go into greed. And research is showing, it's Dr. Masuma कह रही थी कि खाली पेट में जो आपका दिमाग, your cognitive functions work more. And they've found that the fastest way to build more neurons in your brain, the fastest way is through fasting. And they actually say the fastest way to change your personality is, funnily enough, they're actually proving this is in Ramadan. So in Ramadan, when you fast and you meditate, it leads to two things. Not only do you form more neurons in your brain, but it leads to the rewiring of your brain, which is called neuroplasticity. So when you fast and meditate, two things happen. Neurogenesis, new neurons form, and neuroplasticity, that you're wiring, your personality changes. So, it's amazing that, we are running after the West, but the West are coming around and they're coming to the Quran and Sunnah. And this is what led me to, coming to Pakistan and, trying to tell our youth, where are you looking? Where are you going? Like in the Quran it says, فَإِنَّ تَذْهَبُونَ, where are you going? We're looking towards the West, but, they're spending millions and billions and they're coming to the Quran and Sunnah. So that's that. And the second thing is basically I realized that there's actually a model which I've shared in my book, that there's 4 key factors for optimal health. And according to my experience, if you balance these 4 factors, you will not get ill. If one of these 4 factors come out of balance, then you can fall ill. If 4 of these factors are out of balance, then you'll definitely fall ill. So those 4 factors, and I'll save you reading the book, but you can read it if you want more details. One is activity. The second is diet. Third is stress. And lastly, your environment. These 4 factors, once they're in balance, you won't fall. So for example, I'll give you an example. So if you're not eating well, but your activity is fine, I'll give you an example. In Africa or in our region, हम कहते हैं ना घी, देसी घी खाना चाहिए, ठीक है? And in Africa, they have palm oil. Now, the funny thing is, people would say, if you ask the researchers, especially the chemists, they say these are the 2 worst oils to have. Why? Because they're predominantly saturated. Now, it begs the question. So I was in a seminar and I was presenting this information, and my PhD was on oils. So my PhD was on, I turned palm oil into biodiesel, then I turned jatropha oil, coconut oil, camelina oil. So this was what my PhD was on. So I realized how harmful palm oil is, because it has a very high melting point. So it freezes at a very high temperature. So therefore it clogs your arteries. Now, I presented this and I shared in the seminar that palm oil is the worst oil. Then this girl came to me who was from an African background, and she said that, what nonsense are you talking about? She said, my grandmother, she lived off palm oil and she had a very long life, and she had no illnesses. And then I began to reflect and I asked her, her name was Bemi. I said, Bemi, where was your grandmother based? She said, Africa. I said, warm climate. I said, Bemi, was your grandmother sat around in front of the TV all day, or what did she do? She said there was no TV. She worked in the fields all day. Right? And I said, did your grandmother suffer from stress? Was there lots of stress and tension? And she said, no, because there was a family environment and, we lived happily. There was no stress or financial burdens. And I said, although her diet wasn't suitable, potentially, the other 3 factors allowed her to take the palm oil. The climate was right. There was no stress. She had a high activity. And therefore, the palm oil was fine for her. Similarly, in our region, ghee हम खा सकते हैं, इससे यहाँ गर्मी है, ठीक है, उसका melting point वो offset हो जाता है. या अगर आपने घी खाना है मगर आपने कोई exercise नहीं करनी, या आपने जो है tension लेनी है, stress को address नहीं करना, and you go to a cold environment, then obviously it's going to affect your arteries, it will freeze. So these are the 4 factors that I mentioned in my book. So in general, if you balance these 4, you remain in good health. And if these are compromised, then it leads to some sort of illness. And this is experiential learning. I didn't learn this model from anywhere. This is just me as a researcher thinking about things.
Oh, well, that's exactly what Dr. Musuma said earlier. Because if you're from the coastal region, she was saying that, coconut, if you're from the Punjab area, you have different something. What you're saying is exactly the same as we all be saying. So there's, whether you look from, as I think Dr. Musuma said that, whichever angle you, it's the same thing. It's just it's just a different perspective. Same thing.
Yeah.
It's part of being grounded as well, isn't it? That's what I'm also hearing from all of you, that don't be so, dur ke dhol sahane hote, you're always looking over there. Look at what's around you and have symbiosis with your immediate environment. And because this lady was connected to the earth, she was working as well. And people who are connected and at peace where they are, their whole immune system is different. Their nervous system is different. So obviously how they respond to metabolizing food is different as well. So with a combination of, like you say, physical activity and emotional stability, then they can process food in a totally different way. This has been an amazing discussion, but let's look at some of the questions then that people have. I know I am new to hosting here, so if anyone can help me with the questions aspect of things, how do we look at those?
Actually, Sister Shazia, because we're really short on time, because I know Dr. Masuma is really busy. She has a busy weekend, her daughter's over, etc. So, and Hakeem Saab's really, really busy. And I've just seen the questions. Perhaps we could do this some other time. The questions.
Sure.
If people have enjoyed this, and I know I'll request Dr. Masuma se request karta hu aur Hakeem Saab se bhi, if people are also interested, then perhaps we can have another session sometime. And you also asked about what's next or how people can stay connected. I think someone messaged me, I think.
How can people find out more about all three of you? How can people contact you and find out more about
basically what I have in mind as far as naturopathy goes, I've been trying for a number of years. So Alhamdulillah, whenever Allah's written, whenever it's the right time, things happen. I dreamed for this to happen a long time ago, then COVID came. So whatever is written. So jo mera plan hai Pakistan mein especially ke we need to share this information. Asal jo sadqa jari hai, वो उस वक्त आपका जो मीटर ऑन होता है कब्र में जब आप इंफॉर्मेशन शेयर करते हैं. सो आई वांट, देखें काफी लोग हैं they pass away but they've not shared their knowledge and then it's not of use to anyone else. They take the knowledge with them and I don't want that to be the case. I want us to empower. So for that I requested Hakeem Saab, Dr. Masuma, mashallah, she's so busy and she's doing so amazing work that she didn't have time to teach. She didn't have a curriculum designed, or we couldn't get a curriculum designed. So मैंने Hakeem Saab से request की कि he's got the western side of things, teaching the youth in a way that they're familiar with. So Hakeem Saab is launching a diploma course on naturopathy, Unani Tib, acupuncture, hijama, and he will teach us how he teaches in his college in the UK. So first thing is that we're looking for 30 students to sign up. As soon as 30 students sign up, we'll inshallah launch the course. So if you're interested, I will just leave a number in the chat box with you. And
we'll post it as a recording as well on Facebook.
Yes, no, this will be recorded. This will be recorded and I'll load it on YouTube. And so basically, if you want to enroll from outside of Pakistan, then you need to contact Hakeem Saab, Hakeem Saab's college, which is QTAM, CUTAM. So College of Unani Tib and Alternative Medicine. Okay, so and then if you want to register in Pakistan, then I'm just sharing the number in the chat box. And I'll just read it out in case it doesn't come for those watching later on. It's basically 030001242267. This is basically the Academy of Champions number, which is the academy that I run. And you can get in touch with them and you can express your interest to enroll. And Hakeem Saab, inshallah, Dr. Masuma's daughter Elize will be joining us. So Dr. Masuma ne mujhe kaha tha ki Elize ka bhi naam likh le.
It'll be an honor, but I was hoping to learn from Dr. Masuma.
There, I have just offered Adil that you can use my place over here for whatever you want. I'm here for you.
Inshallah. And we will have conversations offline.
Inshallah.
Maybe I might need your support at some point.
Inshallah.
Dr. Masuma has a lovely space. Or space ka naam kya hai, Dr. Masuma ji?
I'm making a place. It's a beautiful sitting lounge, very Ayurvedic, very simple, very minimal, and I named it Astana-e-Kalb.
MashaAllah.
Stomach up.
Like
Inshallah.
heart sanctuary. In English, that would mean heart sanctuary, which I think is beautiful. MashaAllah.
So yeah, so it's I just wanted to add that you know, those that are based in Pakistan and you know, especially Lahore, you know, whenever I have an issue, there's only one person I go to, Dr. Masuma. You know, whenever I have an issue. So anyone based in Lahore, I strongly, you know, advise you to visit. It's in Defense in Lahore, phase 3, mein, Dr. Masuma?
Phase 3, 180Y block, phase 3.
180Y block, phase 3.
Because I like Tabibs need to see another Tabib. So inshallah, I will come to see you so you could treat me as well, inshallah.
I'm
MashaAllah. And vice versa. And you can actually find Inqilab Clinic on Google Maps, by the way, as well.
Yeah.
So if you need to go.
So inshallah, yeah.
Sorry, apologies, Dr. Adil. I've also, I mean, functional medicine is also very, inshallah, very helpful. People like, for example, Dr. Adil has been telling me about how he's helped people with type 1 diabetes. Yeah. And so the video we made, and a lot of people have been contacting me, and I've given them your details. So you're probably getting calls from outside Pakistan too as well.
So, okay, yes, people have been getting in touch with me. So I'll be honest with you, because of the number of projects that I'm involved with, I had some MBBS students approach me. They said, can you teach us functional medicine? What is it and how do you heal people? So what I've done is I've launched a YouTube series. So if you visit my YouTube channel, just my name, I've covered multiple. And so, okay, so for example, when it comes to fertility and conception, Hakeem Saab and Dr. Masuma are the people to go to. Please don't come to me. Okay. Anything acute, please don't come to me. My specialty or area is chronic illnesses. So chronic illnesses as in diabetes, as in blood pressure, as in depression, anything that's chronic, long-term that doctors can, allergies. These are the things that that are my strengths. And functional medicine is really good at. So yeah.
I'd just like to chip in there. I speak for Dr. Masuma as well, that we only treat chronic conditions because they've done the rounds. They've been to the physician, they've been to the local doctor, they've been everywhere, they've been to the PSAB, and they come to the end.
I just
You're the
asked,
last.
for me, I just asked, Adil, I'm coming to you.
Yes.
Okay, so inshallah, so we will share the links and inshallah, if you want more sessions, inshallah, I'll request the three of you again, and inshallah, you know, we can connect and perhaps do a session once a month or once every few months, depending on the time availability. Take away.
I think it would be nice to explore. I have some more questions for another time about certain illnesses and how you'd handle them. And I'm sure that people watching will have questions as well. So let's, you know, formulate those questions. And then according to the response of the audience, we can maybe have some more sessions, inshallah.
Yes, please, more sessions needed.
I've learned a lot. I've learned a lot. I find this fascinating. I'm going to go back and do some more research. I want to know more about the different temperaments and the kind of foods that suit different temperaments. And that's something I'd like to do something on. But thank you so much. May Allah bless you for your time, because I know that coordinating this was difficult. There's a time difference. And then Dr. Suma is very busy. Dr. Adil is very busy. Hakeem Shahid is very busy. I know that. So this is a miracle that this happened, and may Allah Ta'ala place barakah in this, that we can do a few more sessions and learn something more as well in the run-up also to your course, inshallah.
Jazakallah khair, everyone. Jazakallah, Dr. Masuma, Jazakallah, Hakeem Saab, and Shazia. Thank you so much.
Thank you, and thank you for inviting me to host. Take care then, inshallah.
Assalamu alaikum.
Wa alaikum assalam.